dispatch for a 64-year-old male patient who's complaining of shortness of breath. I walk into a lovely home. Patient is sitting upwards. I'm invited in. I see that there doesn't seem to be any danger here. There's one patient, so scene safe, one patient. Don't seem to need any additional resources, and seems to be medical, no evidence of any trauma. I walk in, I say, hi, my name is Matthew. I'm a paramedic.
Hi, my name's Seth.
What's going on today, Seth?
I just can't catch my breath today.
Okay, do you mind if I just grab a seat here and pull up beside you?
Sure.
As I'm trying to find my pen. Thank you so much. Magic pen giver. So you've been short of breath. When did this start?
Generally, if you have any questions.
Well, about a week ago, but I thought it would get better, but today I was just going out to get the mail and been able to catch my breath.
So as I'm watching him, I can see in our conversation that he's got a full level of consciousness. His airway is obviously maintaining his secretions. He's fully coherent. Breathing, he seems, we'll say that he's in mild level of distress. He's got nice full respirations. He's breathing a little faster. And I'm just going to feel a pulse. Do you mind if my partner takes your vital signs?
Not at all.
Okay. Partner's going to come in, get a full set of vital signs, start off with your oxygen saturations and respirations, and we'll go from there. So, I've been feeling unwell over the last week. How have you been feeling unwell?
Just, you know, coming upstairs or walking around, I feel short of breath, but just today it's been worse. Haven't been able to catch my breath.
Haven't been doing. So you find when you're up and doing things, if you're walking or exerting yourself at all, you're getting short of breath.
Exactly. Yeah.
And that's not normal for you.
Well, no, just this last week. Yeah, no, it's just been getting worse.
Normally, you could go up and down stairs and
Usually,
not get short of breath.
Yeah.
Today, what were you doing when you got short of breath?
I just came up the stairs, went out to go get the mail, and that was it. So
Haven't been able to settle yourself back down.
Exactly.
So exertion seems to be making, walking around seems to make it worse, and resting seems to be making it better?
Yes.
Okay. Anything else make it better or worse?
Just sitting down makes it feel
better.
Yeah.
Okay. Have you ever felt any shortness of breath like this before?
Well, I have COPD, so I've been had shortness of breath, but just today it's been worse.
Okay. If you were to rate your shortness of breath today, 10 being the worst that you've ever been and 0 being none, what would you rate this right now?
I would give it an 8.
Would you give it an 8? Okay, so if I'm understanding correctly, I've been feeling unwell this past week. Have you had a bit of a respiratory tract infection, a bit of a chest cold?
I've just been coughing up a bit of mucus more than usual.
Coughing up some mucus. So you've been feeling unwell. Have you been running a fever at all, or no?
No.
No. Okay. And just this past week, I seem to be getting more winded with little bits of activity. And today you went to get the mail and just haven't been able to settle yourself down here. Any allergies to any medications?
No allergies.
Okay. And what medications are you on?
I have a puffer, so I'm on.
Okay. I pull over his puffers. He's got Unvenilin, Atrovent, and Singulair. Any other pills you take?
No, just for I have high blood pressure.
Okay.
So.
Let's say that I see Ramipril on his as far as a pill for his blood pressure. So, past medical history, other than your COPD and your high blood pressure, do you have any other past medical history?
No.
No neurological problems, no history of stroke, seizures, anything like that? Okay. With your lungs, never been told, just the chronic bronchitis, ever been told you have pneumonia?
Yes.
You have had pneumonia before, okay. What was that like last time? Was it similar to this today?
Yeah, fairly similar.
Fairly similar?
Coughing up a lot more.
Coughing up a lot more. Okay. No other history of any other respiratory, like fibrotic lung disease or pulmonary edema? Ever been told you have fluid on your lungs, or
no?
No history of swelling in your feet recently or anything like that? Well, no. Okay. So that's diagnosed conditions. Symptoms: he's had exertional shortness of breath. Any with the mucus that you're coughing up? Any color to that?
It ranges. It goes from clear to yellow to
But you are getting some color in.
Yeah, and I feel like it's a bit more than usual.
Okay, and how much has the yellow? How many days have you had that yellow tinge to it?
Just Well,
In the hospital side, maybe they'll take their time.
A week,
yeah.
okay.
It's just
And has it been
gradually
getting worse?
Yeah.
Okay.
Blood is shunted to
Any history of getting shortness of breath, like waking up short of breath in the middle of the night while you're
Yeah.
laying down?
Yeah, and then I find that I have to sit up,
Okay.
and then it feels better.
It feels better. Okay, that's interesting as well. That could lead me down another route. No, you're totally fine. That's perfect. You're allowed. That's a perfect symptom. So that's history of orthopnea. Have you ever had oxygen? You have to take oxygen at home or just in the hospital?
At home.
Just at home a little bit,
Yeah,
but you're not using that today.
Yeah, no.
No, they've taken you off that. Okay, so I've gone through conditions, symptoms, risk factors, history of home oxygen. Are you a smoker?
Yes.
Still smoke?
Yeah.
And you had history of pneumonias in the past. For any problems with your heart at all? Other than the high blood pressure?
No,
history?
no.
Haven't had any chest pain at all this week?
No.
Okay, and because shortness of breath is a cardiac-like symptom, I'm going to ask him diagnose cardiac symptomology, diagnose cardiac conditions. So I'll ask him any history of chest pain, ever been told you have angina or had a heart attack? No history of arrhythmias, heart feeling like it's going fast or slow or irregular?
Yeah, just when I exert myself.
Yeah, and I felt a nice irregular pulse. So it just gets faster when you exert yourself, but not when you're sitting still.
No.
Don't seem to have any history of that. And I'd go through his cardiac risk factors. We'll just leave that for the time being. We'll leave that until next week. So that finishes out cardiac. Any problems with your upper GI system? Any heartburn? Any nausea, vomiting? No changes in appetite? Okay, bowel movements all been fine? Normal form of
That should be
stool?
normal for you, right?
Any history of urinary problems? No? Okay, and no history of any endocrine problems?
No.
No diabetes, thyroid problems, anything?
Yeah, I got a whole full page.
Okay, and last time you were to your doctor or healthcare provider?
Just to get a refill on the puffers.
Okay. No ongoing medical testing, no blood work or any cardiograms or scans of any such? Okay, I feel like I have a pretty good understanding of your past medical history. Let's just have a look at your, we're going to have a look at your, I'm just going to do a physical assessment,
Sure,
if that's
yeah.
okay. So I'm inspecting his head. I see no scars, rashes, or lesions. His eyes, white sclera. I'm just going to flip your eyelids down here.
Sure.
Don't see any evidence of an anemia. It's nice and red. No pursed lip breathing. No nasal flaring in pediatrics. Can I just get you to stick out your tongue? Okay, seems nice and moist. He doesn't seem dehydrated. Just going to have a look at your neck. Can you just turn your head to the side? I'd ideally like to lay him down at a 45-degree angle to see, but I'll just look and see if he has any jugular veins. I see no evidence. I can see his jugular vein here, but just a little shadow. It's not full at all. So he's got nice, no elevated jugular venous pressure. Just going to push you around your throat here. Great, trachea is midline. Going to look at his chest inspection, scars, rashes, or lesions. I see accessory muscle use, we'll say we see in him. I know he's not exhibiting that. And let's say we see a bit of a barrel chest, so his AP diameter, he's a little bit bigger AP diameter. Let's say he's to here, so he's lost that 2-to-1 ratio. So I'm just going to put my hands here and take a nice deep breath. I'm going to feel how much I feel his chest moving. I'm just going to listen to your lungs if that's okay. I listen underneath the shirt, but for today, just so you can see where I listen, you'll see. So in and out through your mouth, please.
Thank
Well, that's
goodness.
true. Go 98.6 degrees Fahrenheit to Celsius, and then they'll do the beat.
98.2.
And you've had a bit of a cough. Can you just say the phrase 99 for me?
99, 99, 99, 99, 99, 99.
Okay, I'm just going to listen to your back if you don't mind just turning. We'll turn you towards the camera. And we're just perfect. So I'm just going to auscultate in and out through your mouth again. And it.
Does that switch? Yeah, it has to see it. There you go.
Okay, perfect. So that's inspection, palpation, auscultation. I'm just going to tap on your chest here. Your
Take
armpit
your
area.
Fahrenheit, subtract
What is that?
32.
Okay, good. Nice resonance. Any pain in your belly at all?
No.
And you said you have no pain in your chest, no sensation of pain at all, and nothing I did caused you any pain?
No.
Okay, I'm just going to push on your belly. Let me know if this hurts at all. No? Okay, no incontinence, no pain in your legs or arms?
No.
Everything working fine this past week? Nothing new in the last week? Just going to look at your ankles, see if he has any edema, check his cap refill. You can feel that fine, can you?
Yeah.
Okay. No edema. Good cap refill. Feel fine. See, I'm saying that. Can I just see your hand? Okay, no clubbed nail beds, no peripheral cyanosis. Cap refill's good. No centralized, no pulmonary edema. Just squeeze my hands. Great. Okay, so now I'm just going to gather myself, review what I've found in his physical assessment and in his history, and start to think through what could be causing this as far as starting thinking about differentials of different things that could be causing the problem today. We're good to